Thank you, everybody, for dialing in this evening. What an honour it is to be gathering online in this new format, this new world we find ourselves in. So officially welcome from everybody at Opportunity. I'm Ben Scott. I'm the National Development Manager, and it's such an honour to be your host for our conversation tonight. And of course, we're excited to have Jessica Carter with us this evening to share on a very timely topic around COVID-19 and the impact that is having, particularly through the lens of our health programs. So Jess, welcome and thank you for joining us. But first off, wanted to cover off a few of the necessary housekeeping tips. And the first of which is that we would absolutely love to hear from you. So please make use of both the Q&A function. So you'll see a Q&A box at the bottom of your screen. We'll spend the second half of our time together going through the questions that you've submitted and putting those to Jess. So please use that. And additionally, you'll see a chat window. I've already seen a few thumbs up sort of coming through. If you'd like, you're more than welcome to contribute there as well as connect with each other. And the third and final bit of housekeeping is that a recording of this session will be made available. And so you have that in your inbox tomorrow. And yeah, you'll be able to share that with family, friends, or just watch it again if you found yourself missing some key insights. And as we kick things off, I wanted to give you a little bit of the broader story around Opportunity for those of you who are potentially a bit newer to the conversation. And essentially at Opportunity, we give small loans. Often to these families that are living in poverty, and it's often as small as a few $100s at a time. And the purpose of these loans are to help them grow their small businesses and really earn a more stable income. That income, as it starts to tick over and their business grows, gives them the stability to provide a better education opportunities for their children, clothe, feed them, and really break that cycle of poverty over time. Essentially, everything that we do is based around the idea that we want to instill self-sufficiency, strength, and really independence with these people so they're able to live a life of dignity and purpose. The way we work is really through local microfinance institutions, and we're working with these partners across Indonesia and India in the microfinance space. And we're working with over 6 million families doing just that, small loans. And with these loans, 98% of those are repaid. And as that money recycles over time, it means that more and more families are able to access the opportunities that have been afforded to others. So that's the microfinance side. Of course, we have other wraparound programs that really are designed to help families overcome the broader obstacles around poverty, be that health, education, and safety, really with that goal, again, to make sure that families are able to live safe, healthy lives, send their children to school, and yeah, really live a life that's free from poverty. So, of course, we're here. So the topic of the evening is, of course, COVID in the midst of the crisis that we're in globally. Now, this pandemic has touched us domestically here in Australia, but we can't forget the devastating impact this is having and will continue to have on families that we serve in the broader footprint of our programs, and also the broader economies that they exist in. It's a complicated environment for us to continue delivering these programs. And so we're so thankful for your partnership right from the start. And it's really under all of that auspice that I want to introduce you to Jessica Carter. So Jess is the director of our Asia Health programs and oversees our work across Asia, which is really fantastic in that health stream. Jess, thank you once again for the time you're spending with us tonight. And we're really looking forward to hearing particularly around your insights into how everyday life in India has been shaped and changed under COVID. Additionally, how the crisis is affecting families and what that really means, as well as would really love to hear about the impact that the Community Health Leaders Program, essentially your program, and how that's running. Really interested to get your insights in that space as well. So all that said, Jess, I'll hand over to you, and yeah, thank you.
Thank you so much, Ben, and thank you so much to everyone who has joined us tonight. I think it's a challenging time for all of us, but it's really fantastic that we can all connect like this online and really come together around this issue, and particularly to discuss something that is obviously affecting us here in Australia, but very much affecting people who don't have a safety net at all and who are vulnerable at the best of times. So tonight I wanted to obviously talk a bit more about coronavirus in the countries where we work and what that means for the clients and the people that we serve. And then I'd like to go into a little bit more information around how our health program in Asia works, what it involves and how we're helping in this situation. And then, of course, to go into more detail around what comes next and what we think the future holds and what we'd really like to be able to do in the long term. So building on what Ben was sharing earlier, here's a picture of where we operate in the Asia region. And as Ben was saying, Opportunity has a history working around microfinance. But we know that small loans are a really important part of helping to end poverty, but they're not the only part. And so one of the key elements of solving poverty is ensuring that people have basic health so that they can run their business or send their kids to school in the first place. And so in the Asia region, we're in India, Indonesia, and Bangladesh. In India, as you can see, we're doing work in the areas of microfinance, health, education, and safety. In Indonesia, we're working in microfinance and health. And in Bangladesh, we are working in health with a microfinance partner. So our health program very much builds on the platform of microfinance, because we really believe that one of the greatest strengths that microfinance provides is actually the relationships that it builds, the reach that it builds. It enables us to work with communities who are in very often remote or disadvantaged areas, and we have a large-scale relationship with lots of people in those situations. And so by adding a service like health or education onto the microfinance platform, we're able to really target the needs of the people that we're serving in a localized way, but at scale. And that's obviously really, really important. And health and microfinance have a really crucial relationship. They go together, because if you're sick, you can't repay your loan, you can't work. And if you do that, then you won't have the money to help yourself if you get sick. And so it's a very vicious cycle that we know is crucial to address together. Sorry, just getting my mouse to work. So I'd like to begin by really talking at a high level around what coronavirus looks like in the countries where we work, in India, Bangladesh, and Indonesia. I think it's very hard. Obviously, there's a moving feast of information at the moment, and one of the challenges that we actually face in the countries where we work is having our finger on the pulse of what is actually going on, what is the correct data, what are the correct conclusions to draw from the situation. And so that's where, again, having relationships with people who are in the poorest and the most marginalized communities is actually really crucial at a time like this, more than ever, because it enables us to have a more direct insight into how those people are being affected in a way that the big sweeping statistics and media stories might not be able to pick up. So in India, where I'm typically based in Hyderabad, we have seen around 20,000 cases so far. I should note that these numbers I updated 2 days ago, so it's likely that those numbers have increased, but it's at least 20,000 cases in India, with around 700 deaths. A really important caveat for these numbers in India, but also in Bangladesh and Indonesia, is that we don't believe that enough testing is taking place in order to be able to really, truly ensure that that picture that we have is an accurate one of what's actually going on the ground. So while a number like 20,000 doesn't sound necessarily that high, it's fair to assume that the actual figure is much, much higher than that. But India and Bangladesh and Indonesia have shortages and challenges with accessing testing kits. They also have challenges with turning around the results rapidly. And of course, they are countries that have health systems that struggle to meet the needs of their society at the best of times. And we've seen how in our own country, our own health system in Australia has struggled in some ways to respond, and we've needed a lot of additional support to ensure that we are equipped to address this situation. And so in the countries where we work, where there are much lower levels of investment in the healthcare system, addressing the needs of the crisis is really, really an enormous challenge. So India has been under lockdown since mid-March and has at the moment a continued lockdown until the 3rd of May. Bangladesh has been under lockdown since about the same time. They've called it a national holiday there. And at the moment, that lockdown is due to end in 2 days' time. However, it's expected that it will be extended. And then in Indonesia, there is no formalised lockdown, but there are hotspots that are being targeted where localised lockdowns are being applied. And then a lot of communities have actually taken it into their own hands to stop people entering their villages and their communities. One of the biggest challenges in addressing an issue like coronavirus and in trying to limit the spread of the disease is that it's not like applying a lockdown in Australia, where we've seen that our government has had to apply enormous investments into the overall community and enormous emphasis on ensuring that businesses don't go under as much as possible. In the countries where we work, we are working with already fragile systems at a health level, but already fragile systems at a governance and an economic level. And so again, the consequences of a lockdown are really quite severe. So in India, the lockdown was really quite catastrophic and continues to be. It has led to a disruption of the supply chain, which means that mobility and productivity are completely affected. Getting access to basic services like food and essential items like medicines is increasingly hard. So that's a real concern, and that plays out in Bangladesh as well, where they're also under lockdown. So there's a real tension in the way that the governments in the countries where we work manage this crisis in trying to impose rules that are stopping the spread of the disease, but also they're limited in their response to actually be able to buffer society overall from the economic and other impacts that come with trying to stop the spread of the disease. And so based on that, we know that testing is really important, but we also know that prevention is really, really important. And the focus of our health program is very much one around prevention and primary care. And I'll go into that a little bit more. So overall, in the countries where we work, we know that we're only at the beginning of the crisis. We know that there absolutely hasn't been any flattening of the curve, and even where lockdowns as severe as India's have been applied, cases continue to rise. And so the situation that we're looking at is quite a medium to long-term situation where the impacts are going to be both health-related and economic-related. So moving into the health program itself. So to share a little bit of background, which I know some of you on the call will already know, but for those of you who don't know, just to give some context, Opportunity has been working in the health space since 2012. And this really emerged from seeking feedback directly from clients to understand that one of the key barriers that continued to keep them in poverty was in fact their health. As I was mentioning earlier, there's a vicious cycle of health and poverty that go together. And so what the health program really tries to target is preventable communicable diseases like coronavirus. And it's important also to mention that we're talking a lot about coronavirus tonight, but on a typical situation, the illnesses that people in the communities where we serve face are preventable communicable illnesses, just like what we're talking about tonight with COVID-19. So things like tuberculosis, diarrhea, malaria, Japanese encephalitis. There's a whole range of illnesses that are completely preventable, and with the right access to knowledge, the right access to affordable care, and the right access to services and products that will help to solve those issues, we know that we can address the preventable health issues that the clients that we're serving face. And the reason that we want to do that is not just because health is valuable in and of itself, but also because we know that being healthy is the fundamental foundation needed to unlock everything else that comes with that, so that people can actually reach their potential and live meaningful, full lives. So our health program sort of has two main components. And as I mentioned before, we're really trying to address these issues of awareness, access, and affordability. So the way that we really focus on addressing awareness and raising understanding of preventable health issues is through health education. And to date, we've raised awareness with around 6 million community members. Now, the way that that works is not just by us sharing information through our partners that we work with. It's actually delivered through the microfinance clients themselves to their community members. And that's really important, because actually the health education is not so much about knowledge as it is about behaviour change. And so receiving that information from somebody who is your peer means that you're much more likely to take on board that information and to respond with a changed behaviour. And in parallel to the preventative health education, we also focus on health livelihood development. So looking at how we can improve access to affordable health services for all of the people that we're reaching through the program. But in particular, looking at how we can build sustainable incomes for the women who are providing that health education. And we call those women health leaders. And so we know that this combination enables us to reach a large number of people, so we have scale, but also to have sustainability around that. And that's really, really important. So I just wanted to share this quote from a lady that I met on a recent trip to Bangladesh, and her name is Shopna. She lives just north of Dhaka, and she is a client of the microfinance organisation Bureau Bangladesh, who is also the organisation that we're delivering our health program through there. And she said something to me that I just thought was so succinct and so spot on that it just completely summarises one of the key reasons why a health program for poor people is so fundamentally important, now more than ever. And she said, being sick costs money. So if we can stop ourselves being sick, we can save money. And it really is crucial to think about that point, that for the people that we're serving, an instance of illness will only push them further below the poverty line, or in many cases, it will push them into debt. And so helping to empower them with knowledge that can keep themselves healthy in the first place to prevent the very illnesses that will make them sick and make them poorer is really, really crucial. So to date, we have trained around 4,500 health leaders, women just like Shopna, who have educated other community members about the basics of health, hygiene, nutrition, education. And they've collectively reached about 5.8 million people. Now, I'm going to go into in a moment a little bit more around how that is working right now, what that actually looks like right now. But I wanted to first sort of give you a bit of a picture of the strong foundation of the program that already exists and what we're building our coronavirus response on. So those women have not only provided health education, but they've also helped to facilitate access to health products and services that will help people, again, take their own health into their own hands and improve their health outcomes themselves. So there's around 25,000 households who now have access to household private toilets and water pumps. And there's around about 200,000 women using sanitary napkins regularly. We've also seen that around 2/3 of health leaders have increased their income through participating in the health program. We know that that's really important because it helps them sustain that role in the community so that they can keep on providing access to that health knowledge and playing that really, really important leadership role in the community. Before I go into a little bit more detail on our coronavirus specific response, I wanted to paint a bit more of a detailed picture around what the program actually looks like in its sort of reality. So this on the screen is a photo of Kum Kum Devi, and she is a lady who lives in the north of India in a state called Uttar Pradesh. And Uttar Pradesh is one of India's biggest states. It has a population of around 200 million people. So it's a very, very significant state in a country of 1.3 billion. And she is very typical health leader among all of the women that we've trained. She lives in a household with multiple generations. She has 7 family members and she has 4 children. She actually never completed high school herself. She really wanted to, but it just simply wasn't an option for her in her family. And so when she first became involved with the health program, she was a microfinance client for Opportunities Program partner Cashpoor, and she was running a small tailoring business. And the initial reason that she actually signed up to become a health leader was because she saw it as an education opportunity. To her, the most important thing was that it was the chance for her to actually learn something and to learn something more that might be helpful to her family and to her community. And so she became a health leader over 2 years ago and has now reached out to over 250 households in her community. That's well over 1,000 people. And she has really taken on that role as selling sanitary napkins to people in her community, taking her daughter with her to influence other mothers in the community to encourage them to talk about menstrual hygiene with their daughters. So she's also focused a lot on sanitation and trying to encourage families to build toilets, but also really importantly, hand washing, and the importance of not just washing your hands, but washing your hands with soap, washing your hands for long enough, and how important that is in preventing diseases. Now, that's something that we really take for granted. We assume that everybody learns to wash their hands and to wash their hands with soap, but it is actually a really, really crucial piece of information that a lot of the people that we're working with as clients who have very low literacy levels overall and have very low education levels, they might not have received that information at any point. And so something like that, which obviously we know will stop very deadly germs, especially in a moment like right now where we're all thinking about washing our hands more than ever, it's actually a life-saving piece of information. And so women like Kum Kum will do hand washing demonstrations to teach people in the community all of the ways to wash their hands, all of the different places to touch and things to think about when they wash their hands and for how long they need to do that, and to make it fun so that particularly the children in the community will also get on board and do that as well. And Kum Kum is just one of 4,500 women just like her in both India and Indonesia and Bangladesh as well, who we're training to really try and have a cohort of local women who can influence their peers with this preventative health knowledge that we know is so crucial. So in terms of what it actually looks like at the moment around our coronavirus response, there's really two parts of this that I'd like to talk about. The photo on the screen, first of all, is a very impressive group of health leaders, also from Uttar Pradesh in India. And I love this picture so much because it really captures the power and the confidence that they bring to that position of leadership, because it is a position of leadership. And very importantly, it's a position of local leadership. And in a situation like this, we really, really need that right now. So the coronavirus approach looks like two things. It looks like response and adapting the program that we already have. And then it looks like thinking about the long-term recovery. So from the health program perspective, the response is firstly tapping into the existing awareness education that the women are able to provide. Now, because lockdowns and mobility, lockdowns are in place and mobility is incredibly limited in many of the places where we're working, and even in Indonesia where formal lockdowns aren't necessarily in place, it's still very hard for staff and community members to move between locations. So having someone who is within the community who can provide information is really, really crucial. And through the work that the women have been doing, we've also been gradually introducing digital technology, really building the digital literacy of the women who are participating and acting as health leaders, and also gradually socializing the use of WhatsApp messages and things like that with the community members more widely. And so that's something that the women are able to do, to either call or send a message to community members, and really making sure that they are sharing up-to-date, accurate information about coronavirus. That's really important. I can say from my own perspective living in India that accessing accurate information around coronavirus was next to impossible. And that's as someone who knows how to read the news and to analyze what is correct and what is not. So having those women as a source of that, and they have their source as our program partner Healing Fields Foundation, who can give them accurate information informed by health professionals, is really, really important. So that also addresses a component of prevention. The women have also partnered, or our program partners have also partnered with some other NGOs who are testing an interactive voice response tool where you can call a special number and you press certain numbers and it will give you advice on different components around coronavirus, how many cases there are, whether there are cases in your local area, what's the number to call for your local doctor and things like that. So we're also testing that, which is really, really powerful. So the prevention piece is really, really crucial. Another way that the health leaders are adapting is, you've probably seen on the news that a lot of, when the lockdown was announced in India, a lot of migrant workers who were based in large cities and may have had informal work, so they didn't have a stable income, and therefore when the lockdown was announced, they effectively lost their job. And they didn't necessarily have formal housing in the city either. So hundreds of thousands of migrant workers began walking hundreds of kilometres across India to go back to their villages. Now, from their perspective, that's a completely understandable decision. If they didn't do that, they would risk starving in the big cities. But the choice to do that obviously puts the villages that they're returning to at risk. So we've had a proportion of our health leaders also supporting local government workers in setting up isolation centres in local schools so that returning migrant workers have a place to come where they can actually be quarantined for a period of time. And the health leaders play a really important role in monitoring that activity, ensuring that in fact they do stay in quarantine during that period of time. So the monitoring part of the health leaders is also really important. And again, we're using technology to be able to stay up to date with any cases that are reported in the villages where our health leaders are working, or where their community members are, so that we can have an accurate picture as much as possible of who's being affected and what that looks like. At the moment, most of the cases are still seem to be concentrated in urban areas, but because of the real concerns around testing, and the fact that there are many existing health problems in the communities where we work anyway, it is very hard to identify how many cases there are. And so having people on the ground who can give us as much information as possible and being ready to act once more testing kits become available is really, really crucial. To come to the long-term recovery, we know that this is a challenge that is going to continue to exist for some time, and having a cohort of health leaders who are engaged in their communities and who are in a position to really address the responses at a localised level is really, really crucial. When things start to get under control again, that doesn't mean that all of the health problems and all of the health system issues that this crisis has been imposed upon will necessarily go away. So we know that there are going to be long-term economic issues that will come about as a result of the lockdowns and reduced ability to work. But we also know that there could be a build-up of health issues as people don't necessarily have access to healthcare, either because health systems are overburdened or because they've been asked to wait at home and not access healthcare until after the crisis is over. So we know that there isn't going to be a complete end of health problems just because coronavirus itself ends at some point, or at least dissipates. So as a result, I think that a really key takeaway of all of this is that prevention is always important. Preventative healthcare is always an absolutely essential investment. And when the preventative health issues that we're talking about are often the consequence of particular behaviours that can be shifted, having a local health response that is embedded in the local community, that is driven by community members and their peers, is really, really crucial, because we're going to need women who are on the ground ready to respond to the whole array of preventable health issues that continue to be problems for people living in poverty well after this crisis is over. And so that sort of dual strategy of the current response and mobilising the women in ways that we can, in ways that right now we possibly can't even imagine, but their deep community knowledge and their confidence and their experience as health leaders already really positions them well to be able to respond. And then, of course, thinking about the long-term recovery and training more women just like them and supporting these women in continuing to persist in their roles as well, so that we really have a shot at addressing the health issues that affect many of the world's poorest people. So over the next 2 years, we would love to be able to reach at least 500,000 more people, at least. And we would like to be able to train at least 5,000 health leaders across the 3 countries, India, Indonesia, and Bangladesh. We will continue to walk alongside our program partners and the communities that they serve throughout coronavirus. And of course, we will absolutely need to be there for the long-term recovery that will have many impacts for the people that we serve, but who are incredibly resilient and who we sincerely believe will be able to respond if we give them the help that they need. And I think just as a key point, it is that prevention is always important. Investments in health are always important, but I think now more than ever, we can see just how essential that is. So I might finish there and open it up for questions. I can see that there's been a few coming through, but I haven't had a chance to read them, sorry.
Yeah, no, you're right, Jess. I can read you the questions to save you filtering through. I think one that I wanted to highlight is how is the lockdown in its current state really affecting families? What does it mean for a family unit to be in lockdown since mid-March, as you said?
Yeah, I mean, the first thing I think that has to be said is that the lockdown is extremely severe. It's a level 4 lockdown, and the way that it was introduced in India was the Indian government began by basically only acknowledging the issue in airports. So if you were flying internationally, then you would be aware of coronavirus and you were getting your temperature checked when you returned to the country. But other than that, there was really nothing around that would have suggested that there was any kind of level of response. And then Prime Minister Modi announced a national curfew. And he made a very big deal of that. It was supposed to be a 1 day only, and it was, I guess, more symbolic than anything else. And that was on the Sunday. And then 2 days later on the Tuesday, he spoke again. And he announced that in 4 hours' time, i.e. he gave his announcement at 8 p.m. and he made the announcement from midnight the next day onwards. In 4 hours' time, a level 4 lockdown would be imposed on the entire country. And so the consequences of such an extreme lockdown, whilst you could argue that it's very admirable that India, I think, did something so extreme in order to be able to stop the curve, because let's face it, if they don't do something that extreme, that is the only tool that they really have for prevention, because their health system absolutely isn't equipped to be able to respond at a large scale. But introducing a lockdown with such limited notice basically left people absolutely in the lurch. And so, you know, for a poor family, stockpiling food isn't an option at the best of times. And so middle-class Indians even struggled to be able to go out to the shops and stockpile on food with 4 hours notice at 8 p.m. the night before the lockdown was due to start. And so, and a lot of states, including Telangana, where I am, is a lot of states already found that they were under a lockdown. And so there were already existing curfews that meant that people living there couldn't get out to begin with. So the consequences of the lockdown have completely meant that for a typical family, they might still be able to access food, but the supply of that is limited and sporadic and unpredictable. And if you can't stockpile, that's really, really problematic. There's also issues with accessing cash from ATMs. There are issues for people having general mobility, being able to get from place to place. It's easier if you have a car, but if you don't have a car, that's incredibly challenging. And most of the clients that we work with don't have a car. All public transport has been closed. So anybody who relied on trains or auto rickshaws or anything like that to get around cannot do that anymore. So it's basically pushed people into a very insular bubble. And then if you think about the dynamics of a household in India, it's particularly a poorer household. It's usually multiple generations living under one roof. It's usually very, very small, tight quarters to begin with. And the rule for the lockdown is that only one household member can leave that household at a time. And different states have imposed the rules around that differently, but some states have imposed it really, really strictly. And we've also seen really awful reports of, again, poorer people being targeted more directly than middle class or upper class Indians. And so really awful cases of migrant workers walking home getting sprayed with chemicals as they walk, and things like that that are not necessarily helping to curb the spread of coronavirus, but are unfortunately just continuing further to exploit the injustices and the inequality that exists in the system. And so for poor people, it's also a challenge for them to be able to access information. Obviously, if they're running a small local corner shop or something like that, they're not going to be getting any customers anymore. So their cash flow has stopped significantly, or at least dried up. So if they don't have a buffer of funds already to support them, it's a really, really difficult situation. And the other fact that makes it really difficult under lockdown is that people don't know when it's going to end. It's been completely unpredictable. And because there's a tension between the central government, the national level, and the states, there's a lot of mixed messages on whether or not lockdown will continue until a certain time. So again, to use the example of Telangana, they have extended the lockdown beyond the national lockdown level until mid-May. And there's no clarity on how that will differ from the national lockdown, if at all, and what that really means. So the uncertainty for people who already live in immense uncertainty is really, really challenging.
And I think I've got another question here that I think flows on probably quite well from that. Having sort of lived and worked and, you know, experienced India and had built such great relationships yourself, what's your biggest concern for the population at the moment? I guess in India, but I guess Bangladesh and Indonesia would be a part of that too, I'd assume.
Yeah, I mean, I think that the challenge is that the people that we serve are already vulnerable at the best of times. And we've already seen in our own lives how something like this can make all of us vulnerable in different ways, whether it's directly or indirectly for other, you know, friends and family members who we see around us who've been affected. And so I think if you're affected when you already have a safety net, when you have a relatively stable society around you, the consequences for something like this for the people that we serve who are already vulnerable at the best of times are enormous. And they are not necessarily in a position to be able to lean on other people for safety nets. We are their safety net. And so ensuring that we can walk alongside them in this time, and ensuring that we can support them with access to information and the tools that might help them and their communities get through this better, are really, really important. And so, yeah, my biggest concern is simply that the whole world is affected by this, but we cannot let the people who are already invisible at the best of times be even more invisible right now. We absolutely have to acknowledge the challenges that they face are even more immense than those that we face, and we have to support them through this.
Yeah, thank you. And I think we've probably got time for two more questions. They've both been submitted here. If you do have another question, feel free to submit and we can get back to you after the session. We can chat one-on-one. But the next one here is what role does opportunity play in a crisis? It's actually a double-barreled. And so how is opportunity collaborating with other organisations?
Yeah, so as I'm sure a lot of the people listening know, Opportunity is an organisation that focuses on relationships with local organisations. And so we have a network of program partners across the Asia region, some of whom are microfinance institutions and some of whom are non-profit organisations or NGOs. And we work with them because they have local relationships with the community and they have local expertise and knowledge that we can build on and draw on. And so the role that we can play in a crisis is really by mobilising to support those local relationships and those local organisations. The core business that the organisations that we support, which we discussed earlier as microfinance, health, education and safety, all of those things are really, really crucial at a time like this. They're crucial in normal life, but in a coronavirus world, they're even more important than ever. Microfinance is crucial because it is absolutely about ensuring that the people that we're serving have cash flow. Health is crucial because it's absolutely important that those people have access to information and services that can care for them right now. Safety is crucial because it's absolutely unfortunately the case that instances like this do increase instances of domestic violence, and we need to be able to address those. And of course, education continues to be crucial, because we can't have a situation where kids aren't learning for months on end at a time. And so our response is by working across those areas with our partners as the communities need us to. Now, in some instances, as I outlined earlier, that looks like adapting the existing program, adapting the health education messages that the women provide in India, Indonesia, and Bangladesh, so that it includes coronavirus awareness and prevention messages, and so that they know who the hotline is to call and things like that. But it's also very much about business as usual in ensuring that, for example, our microfinance partners, where they are allowed to operate, that they are able to continue to do that, and that they are able to continue to reach clients and to serve those clients. So it's a combination of ensuring that what we already do continues to happen as much as possible, and where it can't, adapting that so that we can still be there. Does that answer your question, Ben?
I believe so. I'll trust that the submitter is nodding along as well. We've opened it up to anonymous questions, so I would thank you personally for that. But thank you, Jess. Fantastic insight as always. I do have one question as well that's coming from Christina that I might answer part of, but Jess, I'll throw to you first if you like. It's just how can we and all of those seeing and hearing about what's happening help right now so those amazing, resilient women can benefit through these hard times?
Yeah, thank you, Christina. I think that from a health perspective, $1,000 is enough to train one health leader. She can reach between 750 and 1,000 people in her community, and she can focus on providing preventative health knowledge and education around both coronavirus, but also all of the other diseases and illnesses that won't go away just because coronavirus is here. So I think that's the most tangible, specific thing that I would suggest right now. Ben, do you have anything to add?
Yeah, well, it feels like an incredible setup, but it's just a really fantastic question. It's actually my next sort of slide, or the one next slide I'd like to cover with everyone. That what can we do? What are our next steps? But look, as we get to that, just want to thank everybody for your engagement and your questions. Thank you, Jess, as well. Been jotting, even though we chat regularly, I've been jotting notes and just a few things that I've really enjoyed about hearing from your perspective afresh. The first of which is just Kum Kum's smile just lights up my day anytime I hear about her story and see that photo. So thank you for sharing her journey with us. And I thought that the way you talked about our ability to position, or our position in country to be there for the long-term recovery through the strength of relationships, I thought that was really profound and quite beautifully phrased. So thank you for that. And Christina, to answer your question, there's a few things that we'd love to encourage everyone on the line to do as next steps from here. The first of which is that we encourage you to stay informed. I know that it's not always easy to do, even as Jess was sharing, that sometimes both for our sort of health leaders in India and accessing the right information or information you trust is really important in terms of equipping ourselves. And so thank you for attending tonight. I think it makes a huge difference, and it's a huge show of interest on your part. So we'd encourage you to keep engaging both with us and other trusted sources in your world. And the second sort of portion to that is that we'd encourage you to bring other people on the journey and to share this story with friends, family, your network. We know that it lights a fire in our bellies, the need and the opportunity that we have to help. And we'd encourage you to share the link that'll arrive in your inbox tomorrow from this session. But additionally, we're going to have the second webinar of this webinar series on Tuesday, the 5th of May. And that will be covering the impact of COVID on communities and taking more of a microfinance lens to that conversation. And look, the third and obviously important thing, and Jess has raised this as well, but we would absolutely encourage you, if you've been inspired, motivated by what you've heard tonight, to jump onto opportunity.org.au. I'll pop the link in the chat window now. So you can click right through to that and you'll see our crisis appeal is live. We're so thankful for everybody that has already been contributing so generously, and certainly invite others to do the same. We know that now more than ever, it's a critical time for your support, both with our health programs, our microfinance work, everywhere that opportunity is. We believe we're strategically positioned for a time like this. And we're so thankful for the partnerships that we have right across the country. So finally, we'd encourage you to connect with us one-on-one. Please reply to the email that you'll get tomorrow, or get in touch if you already have our details. We would love to speak, whether that's a phone call or a Zoom session, much like this, but probably more on a one-to-one basis. We would love to interact with you and help you to play the part that you want to play. So thank you for joining us. We agreed on 45 minutes, and believe it or not, we have hit that right on the nail. So thank you, everybody. We'll see you again on the 5th of May for part 2. And thank you, Jess. Have a fantastic evening. Goodbye all.
Thank you so much. Bye. Good night.